Can you get dental implants with gum disease? Dental implants have become a popular choice for those looking to replace missing teeth, as they provide a permanent solution that looks and feels like natural teeth. However, individuals with gum disease may wonder if they are eligible for dental implants. In this video, we will explore whether or not individuals with gum disease can get dental implants and what factors may affect their eligibility. What is gum disease? Gum disease, also known as periodontal disease, is an infection of the tissues that surround and support the teeth. It is typically caused by poor oral hygiene habits that allow plaque to build up on the teeth and harden into tartar. Gum disease can cause symptoms such as bleeding gums, redness and swelling, bad breath, and in severe cases, tooth loss. Can you get dental implants with gum disease? While gum disease can present challenges for those considering dental implants, it does not necessarily disqualify someone from getting them. However, it is important to address the gum disease before proceeding with dental implant surgery. This is because gum disease can affect the success of the implants and increase the risk of complications such as infection. Factors to consider. 1. Severity of gum disease. The severity of gum disease will play a significant role in determining a patient's eligibility for dental implants. Mild cases of gum disease may be able to be effectively treated before implant surgery, while severe cases may require more extensive treatment and monitoring. 2. Bone health. In order for dental implants to be successful, there must be enough healthy bone present in the jaw to support the implant. Gum disease can lead to bone loss in the jaw, which may affect the stability of the implant. In some cases, bone grafting may be necessary to build up the bone before implant surgery can be performed. 3. Oral hygiene habits. Maintaining good oral hygiene habits is essential for the success of dental implants, especially for individuals with a history of gum disease. Proper brushing and flossing, as well as regular dental cleanings, can help prevent gum disease from recurring and reduce the risk of complications after implant surgery. 4. Consultation with a periodontist. If you have gum disease and are considering dental implants, it is important to consult with a periodontist who specializes in gum health. They can assess the health of your gums and bone, recommend appropriate treatment options, and help you determine if dental implants are a viable option for you. While gum disease can present challenges for those considering dental implants, it does not necessarily mean that you are ineligible for them. By addressing the gum disease, maintaining good oral hygiene habits, and consulting with a periodontist, individuals with gum disease can still be candidates for dental implants. With proper care and monitoring, dental implants can provide a long-lasting solution for missing teeth and improve the overall health and appearance of your smile.